All right. This time we're going to discuss Trichinella spiralis. Again, like what I've said, Trichinella spiralis is usually found in the striated mussel. That's why it is referred to be the mussel worm. Okay. The juvenile size or the juvenile stage of the Trichinella spiralis or larva of Trichinella spiralis is seen in the striated mussel. Now, in the striated mussel, there is what we call nerve cell. And this nerve cell, allow me to write, this nerve cell will help to mature, no, nurture, help to nurture for the maturation of the larval stage of Trichinella spiralis. Okay, and this is the coiled larva of your Trichinella spiralis. Okay, usually found again in striated muscles. Now, what are the other notable features of Trichinella spiralis in the striated muscle? There is what we call inflammatory infiltrate, no, that is present around the nerve cell. Now, for the adult Trichinella spiralis, again, mas malaki po ang female, about 4 to 0.5 millimeters as compared to male, which is 2 to 0.04 millimeters. Okay? Notable features, blunt, round, posterior end for female, and curved posterior end with rounded appendages for male. Now, this is true to both male and female Trichinella spiralis, thin anterior end, okay, smooth, small mouth, and then long, slender digestive tract. Now, for the clinical pictures or clinical symptoms of this patient of this parasite, no, it is necessary. It is necessary to have history. Okay? Baka kasi siya ay forester. Baka siya ay mangangaso. Okay? O siya ay nag uh, travel at nakakain siya ng infected meat ng boar. Kaya siya nagkameron ng infection. Examination of the skeletal muscle is also possible. Okay? And then in patient with your Trichinella spiralis infection or trichinosis, a patient will have an elevated LDH, aldolase, and creatine. Okay? Creatine, phosphokinase, CPK. Why? Because these are all muscle enzymes. And since this is a muscle parasite, nagkakameron ng destruction in the muscle, tumataas ang ating muscle enzymes. No known test is accurate for diagnosis. Bakit? Kasi yung egg niya, pwedeng makita sa stool. Yung larvae niya, sa tissue. Yung adult niya, since sa stool makikita yung egg, din nasa intestine din. Sometimes, if the testing is too early, it can lead into a false negative result. Okay. Take note that this is an infection of wild boars. Remember, Trichinella can be found in pig, deer, bear, walrus, and even in rat. Siya yung common. Man becomes accidental host if the man consumes undercooked meat of the pig. If the man eats wild boars or mga bear. Okay? Paano nila nakuha yan? Mga scavengers sila eh. Yung mga nabubulok, kinakain nila. Okay? Remember guys that the human infection is a result of accidental infection. At ano yung nangyayari? Once na-consume ni man yung contaminated food, undercooked contaminated food, okay? Nagkakaroon ng infection sa tao. Remember that the larvae is released in the small intestine because the egg is in the small intestine. However, the larvae will migrate into the striated muscle. Okay? The egg found in the intestine or the egg found in the stool. Usually nga, hindi nakikita yung egg eh. Egg is undetectable. Kaya nga yung sabi ko sa inyo kanina, siya ay naglilid ng false negative result. Yung adult, nasa intestine. Yung larvae, na-develop sa intestine, pero nag-develop sa muscle. Doon siya sa muscle nag-mature. Doon siya sa muscle nagde-develop to becomes mature. Okay? Now, trichinosis or trichinellosis includes mimics the other diseases and conditions. Diarrhea, vomiting, nausea, abdominal pain, headache, fever, eosinophilia, pain in pleural area. Blurred vision, edema, cough, weakness when muscle is involved, and even death. Now, these are the algorithm for the diagnosis of acute trichinosis, divided into 4 groups. Group A, B, C, and D. A, fever, eyelid, and facial edema, including myalgia. Group B, diarrhea, neurological signs, cardiac signs, conjunctivitis, sublingual hemorrhage, and cutaneous rashes. Uh, Group C, eosinophilia, greater than 1,000 ml per 1,000 eosinophils per ml, and there is an increase in what we call IgE, no, that is commonly seen in parasitic infections. And of course, increase in the muscular enzymes, LDH, CK or CPK, and your aldolase. Okay. Positive in serological test is for group D, seroconversion, and positive muscle biopsy. Again, no treatment medication is indicated, okay, and has a non-life threatening strains of disease. But of course, prevention and control, since this can be acquired through consumption of contaminated or undercooked food or meats, then thorough cooking is possible, is recommended. Okay. The next parasite that we are going to discuss is Dracunculus medinensis. This is the first larval stage of Dracunculus medinensis. Again, this is a facultative parasite that measures 60 by 150 micrometers, consumes one-third of the body length, no? And culminates in point. That is the characteristic of the tail, as you can see in this illustration. So this is the egg of Dracunculus medinensis, okay? And this is the adult of Dracunculus medinensis, as seen, no, from infected ulcer, okay? So the female is typically 840 by 1.5 millimeters, while the male is 21 by 0.4 millimeters. Prominent round anterior end and coiled naman for male. Okay, so it can be absorbed from infected ulcers. No, induced rupture of infected ulcers under cool water reveals the first stage of the larvae. So this is the life cycle of the parasite. Again, take note there are two possible ways on how you can acquire the parasite. Number one, you consume water, no, and this water contains the copods. No, the copods is considered as the host, okay, copods, where the larvae is present. So you consume the water with copods, you consume the water with copods, and the copods contains the larvae form. Then develop in your intestine, and once the larvae release, no, it will mature sa stomach and sa intestinal wall, then will mature in the subcutaneous tissues, usually sa lower extremities, and then will reproduce. The other way of acquiring the infection is through consumption of uh, undercooked fish, okay, na naging dahilan. Bakit undercooked fish? Yung undercooked fish, kinain yung copods. Yung copods, nandun yung larvae, na-develop kay fish. Yung fish, kinain ni man. Okay? So again, in the cold water, nagra-rupture yung ulcer kung saan nandoon yung ating adult Dracunculus medinensis. Okay, so this is an example, no? Ito ay Dracunculus medinensis, no? Allergic reaction as migration to organism occurs. That is what we call Dracunculosis or Dracunculiasis, which is prone to secondary bacterial infections because of the ulcerations. There is a painful ulcers develop and a nodule formation. Okay? Treatment, no, includes the following. Step 1, place affected body part in cool water. Step 2, the adult worm breaks through blisters, explores the water. Step 3, clean, resulting the wound thoroughly. Step 4, windworm around the stick to manually extract. And then step 5 is apply topical antibiotics to ensure there is no bacterial infections. Okay, so for the prevention and control, properly treatment or treat water before consumption, kasi nga pwede doon, no? Prohibits practice of drinking and bathing in the same water. Cease the practice of allowing standing water to be ingested. Educate entire population in endemic areas. And then total eradication of guinea worm will occur. Guinea worm is the other term for Dracunculus medinensis. Okay? Just nice to know, Capillaria philippinensis, no? If you are wondering why philippinensis, because the first case of Capillaria philippinensis uh, was first seen sa Philippines in northern part of Luzon. Now from a 29-year-old from northern Luzon. There are 4 other species of Capillaria: Capillaria hepatica, Capillaria philippinensis, no? Capillaria aerophilia, and Capillaria filica. Take note, guys, uh, Capillaria philippinensis is a zoonotic parasite, okay? Because this parasite is a parasite of a fish-eating birds. Take note, fish-eating birds po yung natural host ng Capillaria philippinensis. Now, how are we going to differentiate Capillaria philippinensis adult? Male is 1.5 to 3.9, female is 2.3 to 5.3. Spicule, 230 to 300 microns. Anus is subterminal for female. Esophagus has a row of secretory called schistocytes. Now for female, vulva is located at the junction of anterior and middle thirds. For Capillaria philippinensis, take note guys that this is resembling a peanut shape with straighted shells. Sometimes it is termed to be the flattened bipolar plugs. I don't know why I don't have picture here. Yan, ito na lang. Yan. That is the egg of Capillaria philippinensis. Meron ding plug, pero flattened. Unlike kay unlike kay Trichuris trichuria, na yung bipolar plugs niya ay prominent. Okay? So take note, flattened bipolar plugs. Yan. Flattened bipolar plug, sometimes referred as guitar shape. So, take note, no, peanut shape, si Trichuris eye, bipolar, si Trichuris eye, football, si Trichuris eye, Japanese lantern. Ito po, si Capillaria philippinensis, peanut shape egg. Take note guys that Capillaria philippinensis, bakit, kung kayo nagtataka, bakit sila ni Trichuris trichuria ay merong the same, almost the same egg structure or appearance of the egg. Because both Capillaria philippinensis and Trichuris trichuria, okay, as well as Trichinella, no, they are under the family Trichinellidae. Okay, they are under the family Trichinellidae. Okay, kasi yan, Trichuris, Trichinella, and your Capillaria. Okay, so this is the life cycle of Capillaria philippinensis. Again, paano po nangyayari ang life cycle ng ating Capillaria philippinensis? Take note take note that this is a zoonotic parasite because the natural host of the parasite is your uh, mali pala, your your fish eating fish. Your fish eating birds. Ano fish eating fish? Fish eating birds. Okay? So ano po yung nangyayari sa life cycle? Okay. So paano tayo nag-initiate ng infection? Ingestion of raw or undercooked fish initiates the infection. Okay, ano yung nangyayari? Adult in the mucosa, intestinal mucosa ng man. Okay? Kung saan merong female, may female, at may male. Copulation will have your egg. Female will produce two types of egg. Isang embryonated at isang unembryonated. The unembryonated egg will be passed through the feces, while the embryonated egg lacks the shells, which will hatch inside the body. Okay? So kapag naman po na-deposit na yung egg sa stool, so pwedeng nandun siya sa body of water, okay, na nagiging dahilan kung bakit nag-emerge sa sea or sa body of water na nakakain ni fish. Itong fish na ito, kinakain ni man or kinakain noong bird. Okay? Take note that this fish serves as the intermediate host kung saan nandun ang larvae form na kinakain ni man. All right. So for the for the infection, we have here your Capillaria, which is an abdominal characterized with abdominal pain, chronic diarrhea, and gurgling stomach. Malabsorption is also possible, no? Protein-losing enteropathy and electrolyte imbalance. Diagnosis is direct fecal smear or using ELISA test. Now, we have here your Parastrongylus cantonensis, which is elongated, ovoidal egg, delicate hyaline shell, no, which is typically 46 to 48 by 68 to 72 micrometers and unembryonated. Now, take note, guys, that the first larval stage of your Parastrongylus cantonensis is seen sa mga rodents. Kaya ano yung common name natin kay Parastrongylus cantonensis? Rat lung worm. Okay? Now remember that the female is typically 19 to 33 micrometers while the male is 16 to 22 micrometers, no? With caudal bursa and sometimes referred yung adult niya as barber's pole. Kung makikita mo yan, yan. Yung parang umiikot, yan. Barber's pole. Okay? Take note, again, yung first larval stage of Parastrongylus cantonensis is found sa rodents. Kaya nga ang tawag natin sa kanya is the rat lungworm. Now take note, nice to know that in the year 1935, yung ating pong Parastrongylus cantonensis ay nakita sa Canton, China. Kaya pala cantonensis. Yes. Do not be confused because Parastrongylus cantonensis is formerly known as Angiostrongylus. Cantonensis. That is the former name of Parastrongylus cantonensis. Again, so this is the life cycle of our Angiostrongylus or Parastrongylus cantonensis. No? Again, take note that man is considered as an accidental host. So paano po nagkameron ng initiation of infection? Ingestion of contaminated food. Okay? Now remember that this will migrate, no, into the brain, no? That can be our sample, no? Diagnostic stage, no? Larvae in the brain. Okay, what else? What will happen is that yung pong ating, bakit nagkakameron ng contamination ng food? Yung pong ating rats, which is considered as the natural host of Parastrongylus cantonensis, na nagkakameron siya ng deposition of the eggs. No? Hatch eggs in the lungs of the rodents. And the first stage larvae are present in the rodent's feces. So magkakameron ng larval stage. Itong larval stage na to, the first larval stage shed from the definitive host, which is your rat, no, and ingested by gastropod intermediate host. Okay, so this is our third in the snail. Doon natin makikita yung ating third larval stage. And snail is the intermediate host. Itong snail, pwedeng nakain ng tao or nagkameron ng contamination ng gastropod, yung mga food na kinakain natin. Na naging dahilan kung bakit nag-develop ng infection. Now, sa tao, kapag nag-cause ng infection, ang kanyang habitat is yung brain. The larvae will migrate into the brain, sometimes or occasionally in eyes or lungs. Okay. Remember guys that Parastrongylisis typically has an incubation period of 6 to 15 days, no? With acute, severe, intermittent occipital and temporal headache. Bakit? Kasi nga nag-migrate sa head natin eh. Stiff neck, no? Paresthesia, vomiting, fever, nausea or blurred vision is possible. And there is what we call eosinophilic meningoencephalitis because of the parasite in the brain. Nandun nagpunta ang ating mga eosinophils to attack the parasite. Travel history is important. Examination of blood is also possible if there is an increased eosinophils. Examination of CSF is also possible, 10% increase. Bakit? Because of the involvement of the brain. And then serological test is also possible. Leading to the, I guess this is the last parasite that we are going to discuss, Anisakis. Second to the last. Anisakis species. Take note that this nematode is present in whales, dolphins, porpoise, walruses, seals, sea lions, and other deep animals. Take note, guys, that this is known to be your fish and marine mammal roundworms. Ayan, yung mga nakikita nyo yan po yung ating Anisakis species. I was able to see Anisakis species in person sa totoong buhay. Nakabili po kami ng isda na merong Anisakis species. And I will never forget that experience. I was able to see Anisakis species from the fish that I love to eat. Okay? So the life cycle includes consumption of contaminated fish, raw or undercooked fish. Okay? Now, for Toxocara canis and Toxocara cati, take note that Toxocara canis is your dog roundworm and your Toxocara cati is your cat roundworm. Take note that they are capable of what we call visceral larval migrants. Okay? Toxocara canis and Toxocara cati can shed 200,000 eggs. 200,000 eggs per day. And this is the life cycle. Okay? So paano po tayo nagkakameron ng ating infection? So the infection, no, through consumption of food contaminated with dog or cat feces or through penetration. Okay? The infective stage is the larval stage. Now, like what I've said, this is originally a dog and cat tapeworm. Dog and cat roundworm. Now, kagaya na sinabi ko sa inyo, these are all possible or can possibly cause larval migrants. So we have your visceral larval migrants, which means there is a migration of subsequent death of larvae in different organs. This wheezing is the common sign of visceral larval migrants. Possible din na magkaroon ng ocular larval migration or OLM manifested in the eye that occurs in children. Ayan, as you can see. Meron pong parasite sa eye, no? A unilateral visual impairment and overt toxocariasis, which is less specific syndrome. Eosinophilia is less frequent. And that is our nematodes. Now take note, nice to know. And these are some of my points for you to remember. Trichinellosis is 4.5 to 55.1% seen in preschool ages, 81 to 57.9% in school ages. Strongyloidasis or the infection to Strongyloides stercularis is relatively rare in the Philippines. Take note that 29% of children have enterobiasis. Remember that Capillaria philippinensis is first isolated in the Philippines, no? Termed to be the pudok worm because it was endemic in the Philippines, particularly in Pudok West, Tagudin, Ilocos Sur, no? Wherein there was 1,000 cases noted and out of 1,000 cases, merong 77 deaths. Again, take note, Pudok West, Tagudin, Ilocos Sur. Kaya po si Capillaria philippinensis ay tinawag na pudok worm. Human infection with Parastrongylus cantonensis was first reported in the year 1945. Saan? Sa Canton, China. At sino po ang nakadiscover nito? Si Nomura and Lin. Nomura and Lin. Okay? What else? In the Philippines, uh, Nishimura and Yogore, no? Nishimura and Yogore, yan, reported the presence of Parastrongylus cantonensis. Take note, in the Philippines, Nishimura and Yogore reported the presence of cantonensis or Parastrongylus cantonensis in the Philippines. Trichinellosis is an infection that is usually maintained in pig-to-pig or pig-to-rat pig cycle. Ulit, trichinellosis is usually maintained from pig-to-pig, baboy sa baboy, or pig to rat to pig cycle. Okay? In the Philippines, no reported cases of anisakis. Although, pwede pong makita ang anisakis species sa mga fish na nakikita sa Pilipinas. What do I mean? No reported cases, no reported parasitic infection to anisakis. Usually, yung anisakis, madalas siyang makita sa Japan. Bakit? Sila yung fan of eating raw fishes. Di ba yung mga sushi, raw po yun, hilaw. Kaya possible po sa kanila mataas yung cases ng anisakis species sa ibang bansa. Once again, thank you very much. And this is the end of our today's lecture.